Hello, my name is Crystal Johnston, and I am an LPN to BSN nursing student at Indiana State University, and I will be presenting my health education project for community health nursing. The title of this presentation is Planning for a Pandemic, and I will be discussing the role of the public health nurse in planning and managing a pandemic. The population at risk is all individuals in the community, with extra emphasis on those at higher risk. The learning objectives for the audience are that the audience will define a pandemic and its effects. The audience will describe the public health nurse's role in preparing an emergency response to a pandemic. The audience will define risk communication as it pertains to pandemics. The audience will list the way that the public can be prepared for a pandemic. The audience will describe the response plan to a pandemic. And lastly, the audience will list resources to obtain more information. Before I begin the presentation, I have included a short pretest for you to complete. Please pause this video presentation and click the link below. There is also a link to a handout to use when following along. According to the World Health Organization, a pandemic is a worldwide spread of a new disease. Pandemics spread quickly because there is no pre-existing immunity within the community. Throughout history, there have been hundreds of millions of deaths worldwide from pandemics. Managing a pandemic is a challenge because it often takes time to understand the disease by identifying patterns of transmission, incubation, altering social habits, and developing treatment and vaccines. By the time these things have happened, the disease has already spread quite rapidly. Since a pandemic is worldwide, all people are at risk. However, some are at higher risk for various reasons. People who are immunocompromised or have pre-existing or co-occurring conditions are more susceptible to infection. People who live in crowded living conditions are more likely to spread disease. Lack of nutrition also makes people more susceptible to infection. People who have lack of access to health care are at a higher risk, as are people with no paid sick leave from their employers. This is a problem because employees are often forced to work when sick because they can't afford not to. Lack of personal protective equipment, or PPE, is a risk factor, especially for those who work in jobs where they have a lot of contact with other people. Homeless and immigrants are at higher risk because they often live in poor conditions and don't have access to health care. So, what is the public health nurse's role in planning and managing a pandemic? The nurse's role includes contact tracing and community outreach. The nurse is involved with testing and public education. The nurse is also involved with risk communication, which is an important part of alerting communities to a new disease. The nurse acts as a leader within public health departments and in implementing interventions. And the nurse works to promote emergency preparedness through public policy. Communicating risk is an important part of planning for a pandemic. This involves providing early and accurate information using multiple media channels and technology. The information should always be provided in multiple language to make sure that everybody has access to the information. Risk communication is a team effort and involves collaboration between experts, community leaders, government officials, and the population that is affected by the pandemic. Effective risk communication is important because it allows the population at risk to make informed decisions and express their concerns. There are organizations such as the Global Outbreak Alert and Response Network have developed global networks for risk communication outreach. An important part of planning for a pandemic is preparing the public. This is done by advising the public to have at least a 2-week supply of food and water, to refill prescriptions and OTCs if able, and to get copies of health records and establish access to electronic health records. The nurse also wants to encourage individuals to develop a plan in case of illness for themselves and their loved ones. The response plan involves how to manage the pandemic and should be prepared as part of the planning and adjusted as new information is available. It is an ongoing process. Responding involves teaching and promoting social distancing in all public indoor spaces. Personal protective equipment may need to be used with teaching on proper use in addition to proper hand washing. Pandemics create enormous financial burdens, and it is important to advocate for financial support for those who become unemployed to ensure housing is secured. Making sure there is adequate food and supplies for those who cannot afford it needs to be part of the response plan as well. Quarantining as needed is part of the response, as is contact tracing and testing. Testing availability is a challenge that needs to take priority during a pandemic. Travel will need to be limited or, in some cases, completely restricted. This may include closing borders. Continuing to prepare for new cases and outbreaks is an ongoing process. And again, it is important to promote these measures through advocating for public policy. In conclusion, a pandemic is the worldwide spread of a new disease that spreads quickly and has no immediate treatment. Everyone is at risk during a pandemic, but some people have higher risks based on current health status, access to health care, paid sick time, and living conditions. The nurse plays a lead role in planning for and responding to a pandemic and advocates for policies that promote emergency preparedness. Effective risk communication is a collaborative effort that involves the public. Preparing the public involves ensuring adequate supplies, getting health records, and planning in case of illness. Responding involves adjusting social habits, providing financial assistance to those in need, quarantining, contact tracing and testing, limiting travel, preparing for more cases, and advocating for public policy. For more information, please visit READY, an official website of the Department of Homeland Security and the World Health Organization's website.